The Democratic Republic of Congo's Ebola outbreak is expected to last a few more months. That's according to the World Health Organization. The WHO's emergency response chief, Peter Salama, says the most concerning area is the northeastern city of Beni in North Kivu province, where dozens of people who may have been exposed to the deadly disease are hiding from health workers. The outbreak has now caused 194 cases and 122 deaths. Two-thirds of cases in the past month have been in and around Beni. Authorities say local mistrust and attacks by rebel groups have disrupted treatment and vaccination programs. They worry that without the cooperation of the local population, they will have difficulty containing it. Joining us now from New York is Dr. Mesfin Teklu Tessema, Senior Director of the Health Unit with the International Rescue Committee. Dr. Tessema, welcome to Africa 54.
Thank you, Linord.
The International Rescue Committee is present on the ground in the DRC to help contain the epidemic. What is your assessment of the situation?
Yeah, the situation in DRC, still the outbreak is going on, and both North Kivu and Ituri provinces are the center of the outbreak. Even the outbreak is expanding actually closer to the border with Uganda. So, the number of cases still continue to increase, and so many cases are being investigated. So we are still in the middle of it. So we are really working hard to contain this outbreak.
So the WHO sounded the alarm through Peter Salama, saying that this may take a few more months to contain it. What is your reaction? Is it as dire as it is?
I agree with Dr. Salama's assessment of the current situation. We are really a situation where we don't have actually view of all the cases, and we still continue to see a sporadic case of new cases coming to our attention. So even in a best case scenario where you are able to track every case, you should be able to monitor all the contact and the contact of the contact. And because of the situation in North Kivu, which is complicated by conflict, and in some areas where communities are not necessarily cooperating, so we are really anticipating that this outbreak may not go away very soon. But one thing is that we are working hard actually just to contain.
And working hard, what is the IRC doing particularly?
So the International Rescue Committee, we've been working in North Kivu even before the current outbreak and providing health care. So at the moment, we are supporting nearly 52 health facilities, really to improve their infection prevention control capacity. That means, their ability to detect case, isolate, and refer safely, and just to make sure that health facilities are not a place for transmission of the virus. So we are, ensuring that those health facilities are adequately equipped, to contain the virus. So that's what we are currently doing. At the same time, of course, we are supporting community outreach in terms of identifying and bringing new cases where those cases need to be treated.
So there are reports also of community lack of trust. What is the problem? What are communities, why do they seem to have very little trust through health workers and international groups that are providing assistance?
There are many reasons. I think mostly majority of communities are collaborating with us. But there are some pocket areas of mistrust, and partly because misinformation about the outbreak, and in a sense that this outbreak has high mortality rate, and some communities are refusing to take the sick to be treated in the Ebola treatment center. So it is, the information that's not necessarily, being disseminated, and some misinformation that we know is not helping, community to understand the risk, and as a result, we are experiencing pushback from some communities. But it is not everywhere. I think there are some only pocket areas.
Okay, and before we wrap, Dr. Tessema, there are more tools this time around. DRC has experienced some outbreaks in the past with success in terms of containment. So there are more tools, but this seems to be more difficult. How do we move forward? Where do we focus to ensure that things get under control?
I think we should still continue to enhance our surveillance and monitor, the communities. So every case detected, we should be able to trace every contact and the contact of the contact. And at this time, we have also a new tool, which is a vaccine, which is really enabling us to contain the virus. And it has been proven successful in the western part of the recent outbreak. So enhancing the surveillance and ensuring that clear message are reaching to the communities, and just continue to improve the infection control at the health facilities, and ensuring that dead bodies are properly and safely buried. So there are a range of things that we are already doing. We need to intensify those activities, but we also need cooperation from the government, international community, really to have peace and safe access to areas where conflict and active violence is happening.
Okay, Dr. Tessema, we have to leave it there. Thank you so much for joining us today.
Thank you very much for having me.
And that was Dr. Mesfin Teklu Tessema. He is the head of health unit at the International Rescue Committee.